Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
More people, including a lot of older adults, are being successfully treated and are surviving cancer. That's good.
That's great news.
Well, that is the good news. But the bad news is that the treatment can cause other problems, including heart disease. It can cause a new heart problem, or it can make an existing heart problem worse.
Well, what can you do about it? Well, there's a new medical specialty area devoted just to that issue, cancer and the heart, and it's called Cardio-oncology. And joining us in studio to tell us about it is Mayo Clinic cardiologist Dr. Hector Villarraga. Dr. Villarraga also serves as editor for the Mayo Clinic Health Letter. Welcome to the program.
Thank you very much for having me here.
Dr. Villarraga, thanks so much for being with us. A new medical specialty, relatively new. I mean, that doesn't happen very often.
No, it doesn't. It's been around now for 8 to 10 years, and it is called cardio-oncology, just like you guys said it.
And that's because more people are able to survive cancer, and so you get the after effects of being a cancer survivor.
Yes, and that's a nice thing. So cancer survival is going up, as well as the age and survival age is going up. So now the side effects of cancer treatment can be happening in the heart.
Mm-hmm.
Yeah, so this is something that you realize because a lot of people in the past weren't surviving, so you didn't have to deal with these problems and the side effects of the therapy, but now you do.
Now we do, but we can also detect earlier damage if there could be and work with the oncologist to try to avoid heart damage for the future.
So particularly a patient who has a history of heart disease and then develops cancer, you want to see those patients to help them through the treatment and also afterwards.
Of course, but not only those, also the ones that don't have heart disease. We would like to be proactive and work with our oncologist to see if we can detect earlier dysfunction of the heart muscle and then give them treatment to cardioprotect the heart while they are getting chemo or radiotherapy or both.
What do those cancer treatments do to your heart?
So there's many classifications of the cancer treatments. We can just say there's one type that could produce irreversible damage, and the main medication will be called anthracyclines. And there's others that are reversible, and I will probably put the majority of all the other medications there. But it can cause fibrosis of the heart muscle. That means it cannot contract well.
That's scarring, basically.
It's scarring, yes. Mm-hmm. And the others could produce inflammation of the heart muscle, which acute changes, that acute heart failure that can be, the patient can improve just with medical treatment.
What about radiation?
Radiation is very interesting because we have the old radiation technique, which is called photon therapy, the new kid on the block, which is proton therapy. And for the photon therapy, the old type, which is this X-rays, it produces acceleration of atherosclerosis, so plaques in the coronaries. But in the early 2000s, somebody said, hey, I'm going to try to do a study to see if we can decrease radiation to the heart. And it was so simple. Just a breath hold during radiotherapy avoids a lot of extra X-rays to the heart. So that changed the landscape a lot. And then came the new kid on the block, which is proton therapy, which just delivers the amount of beam there in the tumor, so it avoids the heart a lot.
So they can basically stop the beam before it gets to the heart.
The proton will just explode, if I can put it like that, next to the tumor and not around the heart or the other structures.
Yeah.
So that's amazing.
Huge advance. So I assume that the oncologists try to avoid those drugs that can potentially cause irreversible heart damage, but sometimes they can't. And if they've had a drug that exacerbates a heart problem, how do you detect that?
So there's different methods of detecting it. But one of the main cornerstones of medications that they use, anthracycline, which has been around for a while, they use it for sarcomas, breast cancer, and lymphomas.
Is that Adriamycin?
Adriamycin,
okay.
Yes. And what they do is now they know up to what dose they have to give the patient before it can have severe side effects, which is 250 milligrams per meter squared. After we as cardiologists suggest the oncologist that every 50 milligrams per meter squared, the patient should be monitored with an echocardiogram just to check that the function is well. We can go beyond just the basic echocardiography and look at how the muscle deforms. And that's another new kid on the block, which is called strain echocardiography, which just looks at the deformation of the muscle. And we have many protocols that we can predict who's going to drop the function of the heart or the ejection fraction in the future just when the strain changes.
So electrocardiogram is basically an ultrasound of the heart, right? No radiation involved?
The electrocardiogram will be the electrical part of the heart. The echocardiogram will be the ultrasound of the heart, which is no radiation at all.
What about what should all of the cancer survivors that are listening, what should they take away from this? Should they go and talk to a cardiologist and say, this is something new, I should be seen for this? What should they do?
That's a great question. So what we want the cancer patients to be proactive with their oncologist, ask them if they need to do something to protect their heart while they're going to start treatment or not. If they are, they should have a cardio-oncology team next to them that can work with the oncologist. The idea is not to take the patient out or do not give the medications, just to protect their heart while they're receiving it. And then we have many guidelines to follow depending on the medication, how often they have to be imaged or seen. And that's, you can Google it or you can just look at it on our website, mayoclinic.org, how frequent they need to look at your heart.
And is this something that for cancer survivors, that first 5 years is so important, or is this going forward for the rest of your life something that could be of concern?
So of the first 5 years, depending on the medication, if it's just Adriamycin, we evaluate the patient before the medication, during the medication, and then 6 months after, and then 5 years then after every 5 years. If it's radiotherapy, we talked a little bit before about accelerated atherosclerosis. We want to do a stress form of test on that heart 10 years after radiotherapy because patients can develop plaque before the normal population does, and we have to be aware of it.
So just to be clear, there's an increased risk of developing heart disease when you have cancer, but it's based on not the type of cancer that you have, but what kind of treatment you get, what kind of chemotherapy you get.
That is correct. Very good assertion. Yes.
And Adriamycin is kind of the
Adriamycin is one of the big ones that can harm the heart, but we have now protocols that you can cardioprotect the heart while the patient needs higher dose of Adriamycin if needed. So for that, we just work very closely with our oncology colleagues.
And fortunately, it's a relatively small number of patients that have cancer who develop problems with their heart during treatment or after, right?
That is correct. Actually, to answer that, we did a very interesting study here in Olmsted County, and we followed 1,000 patients with cancer and 1,500 controls that had the same diseases but not cancer. And we found that the incidence of heart failure was about 8% in the cancer patients, while the normal population about 3.5%. So it does double the incidence of heart failure.
Well, fortunately, not that many people being treated for cancer do develop heart disease. You said about 8% versus in the population 3 or 4, so maybe double.
Maybe double, but that's in a 25-year follow-up. When you have, sometimes in the acute setting when the patient is receiving chemotherapy, they can have side effects of other medications that can take them into acute heart failure. But normally we manage that. They stop the chemo for some weeks, and the patient can be given medications again for the heart and restart it.
All right. We now know that it's important to be proactive in preventing heart problems or catch and treat them as early as possible. There's a team of physicians at the Mayo Clinic who do just that, and they are called cardio-oncologists. One of them, Dr. Hector Villarraga. Dr. Villarraga, thanks so much for being with us.
Oh, thank you for the opportunity.